Hello, I'm a liver surgeon and routinely we do transplantation. Many patients are not keen to have a liver transplant done. And the first thing I want to say is that I understand. If I had to have a very expensive operation that has got an 8-9% risk of death, I would not be too keen as well. I understand. I sympathize often. But still, I often tell patients, let us do a transplant because the risk to them, to their lives, without a transplant is much, much greater. So, for example, an average patient who comes to us for a transplant has a MELD score of about 18 or 20. With a MELD score of 18 to 20, they have nearly 70 to 80% risk of death over the next 1 year, or even higher maybe, because often they deteriorate. So if you compare the 8 or 9 or even 10% risk of death with a transplant, without a transplant, their risk over the same 12 months is 5 times more or 7 times more. Therefore, when you balance the risk, you find that transplantation gives you a far better chance of survival. This is why, despite the cost, despite we know all about transplantation, we know that the patient needs lifelong immunosuppression. Despite all that, the only way sometimes to save their lives is to do a life-saving transplant.